Today is the 13th of August 2020. This is day 2 of inpatient. A 1-year-old female red slider. As you can see by the blackish spot, this is the wound from the abscess lensing done. Yesterday, she came in with a very large ear abscess. Dr. Daniel then carried out abscess lensing by using a scalpel blade to remove the pus.
The pus was expressed out after the cut. Yeah, you can see the pus is thick and like cream like that. Yeah, it's creamy, and this is an example of the pus taken out from the ear. And in the red ear slider, the pus is not the liquid type, unlike the pus in dogs and cats. So this one you have to express out or curate out 100% of it. If not, the ear abscess will recur again and the owner wouldn't be happy. So now what we do post operation, okay, discuss about it.
We use antibiotic drops for the wound.
Today, what did we do today?
We need to clean the wound, so we make sure that there has no more parts inside. So we use the cotton bud express off all the parts.
You see the wound actually.
Yeah, there has no more parts
There's
already.
There's a bit there. See, is there some
It's
parts?
not the skin.
It's a skin and muscles.
Okay, that's
No more
good.
parts already inside. And then
It's
after
a bit
that,
bleeding, yeah. Okay.
we use the antibiotics ear drop
Yeah.
and we put in the drop.
Yeah, these antibiotics will also irrigate the wound and also to kill the bacteria. Any bacteria there. Okay, after that, cotton bud, what do you do?
We press out with the cotton bud and make sure the wound is clean.
Clear. You do how many times?
2 times a day, and then we also start the oral medications, antibiotics and painkiller.
How do you do it?
For the feeding of the medications, we hold the terrapins and then we can take out the sides of the mouth to open. At the time we use the syringe and we drop the antibiotics drop into the mouth.
Okay, and the painkillers too.
Painkiller also.
Yeah, in this case, this shows that the red ear slider is quite easier to open the mouth.
And
Some of
then
them difficult, yeah. Okay,
this
this
red
is the
ear
part 1
slider-
of the problem. Okay.
Yeah.
So we finished with this part 1 of the problem first, and tomorrow day 3 will continue the same treatment. So now we go to the second part of the problem of this red ear slider, which is 1 year old. Okay, what's the problem?
The terrapin also have the shell rod.
As you can see by the white patches on the shell. Usually, the terrapin is supposed to have
White
a
spots.
very green
White spots.
shell.
Okay, yeah.
Here.
The white spots. White spots. So on the top surface or
Yeah,
everywhere? Upper surface?
At
only?
the sides as well.
Surface, and then
The bridge. Oh, this is the ventral. And the side, the bridge. The bridge is where you can see those are the fungus are there. The black greenish part of it. That is the bridge. Okay. Now look at the claws. Is it long or short?
short.
Put it properly first. Then we see the claws. No, put it the correct way up. Now if the claws are short and sharp, or long and sharp.
Short and sharp.
Short, okay. Then that is likely to be female. At 1 year old, you can tell actually. Okay, then upside down. See whether it's flat or concave.
Looks like flat.
It looks like concave, right?
A bit concave, but mostly it looks like flat.
It looks concave. It look at the horizontal. Put it horizontally, upright. Can see, Turn to no, not this way. The other way. Is it concave? It looks concave to me.
Looks a bit.
So it's most likely a male because the claws might be not fully grown yet. Okay, anyway, male or female, we can't tell, but basically when you look at the lower part, look at the vent, is it near to the end of the shell or is it far away from the end of the shell? If it's far away, it is likely to be male or female.
It looks like near. It looks like near to the shell.
Far nearer, right?
Yeah.
It's near to the end part of the shell. Where is the vent? Point the vent. Use the forceps. Where's the vent? No, for the nearer the shell.
This one.
Yeah.
So there's the vent. So if the vent is nearer to the edge of the lower shell, then it is likely to be a male. Correct?
Yeah.
If it's further back to point further back to the tail tip, is a female. So we have two characteristics. So it's likely to be a male. Okay. So what do you do for the shell rot?
For the shell rot treatment, we use antifungal shampoo, and we use a brush to brush the shell in concentric circles, and then we will
Wash.
dry the shell
Wash
and
off lah.
use antifungal cream. We place the cream for about 2 to 3 hours, if not one whole night.
Overnight dry docking, yeah.
And the next morning, we'll repeat the treatment.
When is it going home?
Tomorrow. The owner want to hospitalize today. After that, they said they want to take care by themselves.
Okay, so we give them the medication.
Yeah.
So that ends it. So what is the conclusion?
Conclusion is that the environment of the red ear slider is very crucial.
What do you mean by that?
The water must be hygienic at all times, and there must be a temperature gradient in the water, as well as a hot and dry place for the terrapin to bask and change its body temperature, as they are cold-blooded.
What do you mean by water gradient, temperature gradient?
That means there must be a hot spot and there must be a cool spot.
In the water?
Yes.
How's your appetite?
It's eaten when he finished about 30 pieces of pellets.
How many pieces?
30.
30.
Yeah, and then have stew about 3 or 4 pieces.
Well, the thing is that it's quite small size for 1 year old.
Yeah.
So that was he eating 20 to 30? 30? No.
Yeah, maybe
Pellets.
the area is quite small for him so that he don't grow too much.
Exercise.
Yeah.
Okay, then we should stop now. Finish it.